Have you been considering breast augmentation or breast enlargement procedure? Hi, I'm Dr. Timothy Shim, plastic, reconstructive and aesthetic surgeon. Let me bring you through the 5 most common mistakes that you may make before you undergo this breast augmentation procedure. First mistake you can make is selecting an implant based on what you see on the internet or what your friends recommend that you have. Let me bring you through a process of how we can select the best implants for you for breast augmentation. There are a series of breast implants that we can use, and the most common one being used are the silicone implants. They exist both as a round implant like this or as a teardrop shaped implant like this, which is narrow on the top and broader at the bottom. There are also 2 different types of surfaces, one being textured. This is a micro textured implant, and this is a nano textured implant. They also exist with an entirely smooth surface. So this is a smooth smooth implant. During the consultation process, we will do a series of measurements of the chest wall and also dimensions of the breast itself. And with these dimensions and measurements, we can then select the best suited implant that would fit and look nice on your body. Secondly, we will also take a series of pictures, and with these pictures, we will upload it and run it through a computer simulation program. We can then select the best implant that will produce the most predictable breast augmentation that you can have, and also to create the best shape that you can get after the procedure. Mistake number 2 is not selecting the right surgeon to do this procedure for you. You should approach a surgeon, in this case a qualified plastic surgeon, who is familiar with the procedure and who has the required experience to ensure that you have a predictable, good enlargement and a good shape following the procedure. This is usually commonly the board certified plastic surgeon, and the surgeon should be one whom you can relate to and freely ask questions and who can address all your concerns before and after surgery. Mistake number 3 is not wearing the appropriate supportive garments following the breast augmentation procedure. During the surgery, we will be creating a very accurate pocket to place a specific implant into your chest. And this accurate positioning of the implant within the chest itself is important to create the most ideal shape following the breast augmentation procedure. And very importantly, in order to maintain this very specific and special position, you will be required to wear a special supportive bra following the surgery. And this bra is important to ensure that the position is maintained long-term within the chest itself for the breast implant. Secondly, the bra is also very useful to reduce swelling and bruising during the initial healing period. After 1 month, you may then resume to wear your normal supportive bras, and it is good and also recommended for you to wear a bra long-term in order to provide the best support and also to maintain the breast shape following breast augmentation. Is it okay for you to go braless following the breast augmentation procedure? Certainly so. You can go braless occasionally for certain periods of time. However, it is recommended that you still continue to wear a good supportive bra following the procedure in order to maintain the ideal shape of your breast. Mistake number 4 is ignoring signs of infection. So what are these signs of infection that you should look out for? They include fever, chills, increasing redness over the breast or the wound, and sometimes pain. If you experience any of these symptoms, you should visit your surgeon urgently. Most of the time, these infections can be treated with antibiotics and salvage the situation. However, if the infections do progress to become more severe, it may mean that the implants need to be removed. Mistake number 5 is neglecting to take care of your scars following surgery. So immediately after surgery, specialized dressings will be placed over the wounds until the wounds have healed. The wounds will usually take about 10 days to 2 weeks to completely heal. And once the wounds have healed, we will then move on to management of the scar, also known as scar therapy. Scar therapy will include the utilization of scar tapes as well as silicone creams. Occasionally, we will also add on laser therapy to help the scar to look better, to reduce its pigmentation or redness. And it may take up to 6 months for the scars to completely settle, that to become a soft and flat scar. An ideal scar following breast augmentation surgery is a soft scar that's hidden in the undershadow of the breast. Thank you for watching our video on the 5 most common mistakes before you embark on the breast augmentation procedure. If you would like to learn more, do visit our website or contact us today to schedule an appointment for consultation. And also, remember to subscribe to our channel to get the latest updates on aesthetic procedures. Goodbye.